Hello, everyone. You are listening to The Local Lens, the podcast from the Powell County Health Department where we go inside our community's experience with the drug epidemic. Our show is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. Our show is exploring our community's collective experience with addiction and this drug epidemic, and we're doing that by having focused and intentional and in-depth interviews with people who have lived experience. So this interview features a few ladies from a Nar-Anon support group that meets in Richmond, Kentucky, whose children all battled addiction. Our three guests this week are Marty Hackworth, Becky Wolfenbarter, and Helvey. And this is actually part 2 of the conversation that we had with these ladies, so if you've not heard part 1, then stop what you're doing, get off of this episode, and go listen to part 1. In that episode, we introduce these ladies and start giving some of their backstory. But this time around, we are talking about their response. They all three lived through some very hard stuff, and they all came out of it with a big bat, swinging it around and making a lot of noise. So thank you guys for tuning in. You are listening to The Local Lens from the Powell County Health Department and Kentucky Rio. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do.
My name is Marty Hackworth. I am a Nar-Anon general representative of a Nar-Anon meeting group. It's a support group for people that have loved ones that have substance abuse disorder.
My name is Becky Wolfenbarter. I'm a retired nurse. I met Marty when Paula asked me to go to a meeting. Paula and Lucretia asked me to go, and that was a change. That's when my recovery started with my adult son that has addiction.
And I'm Helvey. I met Marty also through her Nar-Anon group. Someone reached out to me. They said, hey, I think your son's smoking more than pot. That's how it all started. And they suggested I go to her meeting. So I did, and we've just become, I attended her meetings regularly. It's a very good support group for people who have a loved one of a brother, sister, aunt, uncle, dad, son, whatever, that suffers from substance use disorder.
So you could definitely say that these ladies have all been through the ringer themselves, but they've come out on the other side of that adversity with action, and they're doing something about it now.
But the drugs out here they're terrible. Fentanyl is in everything. It's in marijuana now, for goodness sake. Pressed pills. We have people dying at an enormous rate, and it's so sad. And until we get a community that works together to decrease the stigma, increase awareness, increase resources available to families and those suffering, then we're not going to combat it. It has to be a total, thing. I can't fix it. I wish I could. And love can't fix it. And I love everybody. But if your love for your child could stop their addiction, it would be eradicated. So we have to do other things.
And the stigma, it's so strong, it's so undercurrent of it. Some people's like, well, they're not useful to society, so who cares if they kill themselves, Well, guess what? Some of these people recover.
Absolutely.
They go on to live productive lives. They go on to be a part of society that you would meet them and you would never guess that they was an addict. I took care of a couple yesterday, and the woman and her husband, and they had 5 years in recovery. And they told me, I just brought it up. I knew her history from being her nurse, and I just out there with it, And she said, you're the first person that has talked to me about it. It's on my record. Yeah, when people give we give bedside reports. She said, they mention other things, but they don't mention that part. She said, but how they treat me, well, I don't know about giving you this pain medicine. She said, tells me that they think, oh gosh, she's just an addict. She's going to want all the pain medicine you can give her. She's like, she said, you're the first one that's talked to me that understands addiction. But you also understand I've had surgery. So you're trying to help me understand, negotiate how I'm going to get through this surgery and get pain relief without going back down that road of addiction. And she said, I appreciate that, And I said, because I believe it's a disease, and I don't want you to go back. You worked very hard to get where you're at, and I'm very proud of you. And I don't want to, in no way, for the medical community to set you back because you had to have an operation, So changing the stigma of it is, you're always going to have people that, we can't fix how people think. You're always going to have people that are prejudiced, people that are short-sighted, they don't see things in a different way. You're not going to change that. I don't care. People are prejudiced against fat people. People are prejudiced against black people. People are prejudiced against, different things. And that speaks of them. That's not the whole community, But if you can change somebody's point of view about it, then do it, And I think some of the nurses I work with, by seeing what I've gone through and how I changed over the course of years of being so devastated and so to being a person that actually works to help people now. Laura and I both help with addiction in our county. We have a group called SPARK Ministries, which SPARK stands for Special People Advocate in Recovery in Kentucky. And how we got that started was through our Nar-Anon group. Through her and Paula losing their sons, we all realized, okay, we've supported each other, we've been there for each other, but now we got to do something more in the community to help this problem. Because if us moms don't care, who's going to care enough to do it? So, we went to the police departments when Laura's son died, all as a group, talked to the police, the chief of police, because her son's death was not investigated. The case was not picked up. And so we went to him and she said, okay, what do you do about drug addiction? What do you do about a drug overdose death? And he said, well, we investigate every drug overdose death. And she said, really? She said, well, I come and got to the police station, got my son's report, and here there's not going to be no investigation. Here's his 2 phones that nobody picked up.
Right.
And look, and it's got all kinds of messages on it. So, no, that's not happening. He's like, I'll get right back to you. He gets up and walks out of the room, and he comes back and he apologizes to us. And he said, I'm so sorry. We do not have a policy that says we will investigate every drug addiction, overdose death, And he said, but I promise you, ladies, I will get that going. That will happen. And he did.
He changed from the moment we walked out of that office. He changed policy that day.
Yeah.
He did. He sent out an email, that he knew they'd dropped the ball. I love him. I can't scream his accolades enough.
Who is
Rodney Richardson. He was the assistant chief. He's now the chief. And, rightfully so.
Of the Richmond
Police Department. And he is wonderful. I can't say enough about him. And unfortunately, Daniel died of a 100% fentanyl overdose. Was clean. Other than that, he had been in recovery, and he just always struggled, and relapse is part of it. And that relapse took his life.
I'm sorry.
It's okay. I'll never know why, but I know that there's a plan. And so had it not been for the Nar-Anon group, I probably wouldn't be strong enough to tell his story and to get out here and to help others. I tell people every day, I'm out here giving out Narcan, doing Casey's Law, because I don't want some other mama to go through what I've been through. That is my goal. If I can stop this mom from having to bury their child, and yes, if we have to go to court and force him into treatment, that's fine. But I'll also, if I see you on the street and I'm like, hey, if you need help, call me. And you call me, I'm going to get you wherever I can. And it's about meeting people on their level, where they're at, not judging their recovery and where they are. I'm a judgment-free zone. Judgment-free. I'm going to love you where you are, no matter where you are. And when you need it or want it, I'm going to be there for you. So, and I don't think I would be this person had Daniel not died. Now, that may be his, what he was here on earth for. I don't know. But I'll never know. I just have to go on.
I remember at his memorial service, you said, I will do something. I will be doing things, and just right away, just like you said, that officer changed. You did. You hit it right on.
And her son had passed in 2019, which is just 2 years before we recorded this interview.
Yeah, we walked out of that police department, and that impaired us. We was like, okay, what else can we do? We went, and when we heard about the SPARK Ministry, I'd went to a Casey's Law training thing they had in Madison County and heard about, SPARK Ministry, and I thought, that's what we need to do. So I brought it up at the meeting. It's like, this is something that we can be a part of, that we can, do. And, but I'm doing this and that. I can't be the leader of that. I'm spreading myself too thin. I'm also a lactation counselor and this and that. And, I'm spread pretty thin.
And I have a family.
Yeah. And, but Laura stepped up and Laura said, I'll do it. And I said, I'll be right by your side. I'll try to, every way I can be, I'll be right there, and she did. She stepped up and she took the reins and she has ran with it. And we started out in the library one day a week. We got a little area there that they let us have. We started out there giving out sandwiches, talking to people, letting people know that's where if you want to do Casey's Law, you come there, we'll help you. We'll hold your hand through the process. Because all of us had done Casey's Law. We knew how hard it was. It was very hard to do. I mean, it's so worth it, but it's so hard to do. And a lot of people say, well, they gotta want help. Yeah, they gotta want help. But the mind's got to heal to make a rational decision. So my son couldn't have fought himself out of a wet paper bag, He was that bad in addiction.
That is a great saying.
He couldn't have got himself in a rehab, He didn't know enough that he could even recover. He had literally thought, I can't beat this. This has got me. I wish I would just die so my mom quit suffering. He told me he thought like that, And I did Casey's Law on him, and he was angry at me. It was a very stressful day. He was very angry at me. But within a month, after he was in rehab and got his body clean and mind cleaner, he was thanking me for doing it, for saving his life. And he got the rehab he got. Yeah, he relapsed after that. But each time he went to rehab, he learned something more about himself and about his disease that helped him the next time to get in recovery, And it was worth it to give him the months that he needed for his brain to heal, for his body to heal, And eventually they wanted more for themselves. And at the end, he told me, if I relapse, he said, Mom, let me be homeless. Let me live the life of a homeless addict. And maybe then I'll want enough to get the help and do what I need to do to get help. Well, unfortunately, that happened. And, and he did go homeless. And he did bring himself into the ER and want detox. He did know enough from going to rehabs how to get help and got help,
As a mother, how hard was that to see that happening?
Extremely hard.
It was in the winter as well.
Oh, goodness.
Yeah, at one point, I picked him up. He said he wanted to go. This was before this time, but he called me and said, I need to go to the hospital. And, I picked him up and I dropped him off at the hospital. But I didn't go in there with him because I knew I would just, fight for him, and he needed to speak up for himself. He needed to do this for himself. But I felt so guilty leaving him there. I called them crying, what do I do? Should I go back? Should I make sure he gets in? But I wanted him to step up and say, I need help, not just go in there and get maybe detox, but then go right back to it, And that's where the group come in and help me. That's where the meetings help you to stay strong when you doubt yourself or you fall back to your old ways, that help. But helping other people helps you. That's part of the step work meeting too, is reaching out and helping someone else that you've seen, oh, I was that way. That's how I was when I first came into a group, crying and tore up. I'm a lot stabler now. I can step back from this disease and not let it destroy me. So helping other people get to that point so they have a better life is what we do in this group too. We're not perfect by no means, and we admit that we're not perfect. When you come in there's this feeling that you have like, maybe I was a bad mom, maybe I didn't do this right, maybe my son seen me drink a little bit too much at one time, or this or that. I mean, we beat ourselves up for it, and you got to admit we're not perfect. But we didn't cause this. But helping other people and making a difference in the community is, we all got to work together. If we don't, this is going to go on, and I don't want to see my grandchildren. I don't want this to be out there for my grandchildren or teenagers. Whether or not that's going to be the case, I hope not. But I hope the community will be at a place where we can do more education to the young people. You can have a police officer in schools and say, don't do drugs, and that's been proven not to work. What I think the solution is to let young people that have gone through addiction, that have got recovery, go into the schools and talk to these young people. Tell them their story. That's who they're going to listen to. That's who they're going to pay attention to. They're not going to pay attention to adults. They need somebody that says, I was just like you in the 6th grade, and then I did this, and this is what my life became. And tell them the horror stories that their life became before they got recovery.
And I can happily say that's starting to happen.
Good.
Yeah, and it's actually through employees of SPARK in Stanton.
Good.
Are getting into Powell County schools. Hopefully, I don't know what's happening in other counties along those same things, but it's coming from SPARK.
Right.
So, yeah.
And it has to be, and that's one of the things that I try to preach to people is, if you don't, because a lot of people don't believe in giving people Narcan. Why do you do that? They just keep doing it over and over and over and over. Well, if they've been in addiction for 15 years and they recover and they were Narcaned 15 times or 20 or 25, and then they go back out in the community and they're out here making speeches to children or to people in the jails and ministering to them about how they've come out of recovery, and they see someone that they knew in active addiction. Do you know what a seed that can plant? Hey, if that girl come out of it and I've seen her at her worst, then I can come out of it. And so every person that recovers can be a light and a seed that's planted for somebody else to accept recovery, however it may be. Thankfully, right now, there are more resources available for recovery avenues than there were when Daniel was in active addiction. I had the best dang insurance on the planet and couldn't get a rehab in Kentucky to take him. Had to send him to Michigan and California. That's changed now. There's so many more options for recovery. There's just so many more that even will do free rehabs. There's different types of treatment, and I don't knock anybody's treatment. If you want to do methadone, you want to do Suboxone, you want to do 12 steps, you want to do smart recovery meetings, you want to do whatever gets you there. If it's Jesus, if it's 12 steps, if it's medication, whatever gets you to sobriety and to living a productive member of your life, to have where your kids have a mom or a dad, or where your mom has a child that she gets to see be married and have children, then I'm for it.
The ultimate goal isn't even to eradicate drug use. You're never going to get rid of drug use. It's been around since the dawn of society. Our realistic goal, instead, is to fill our communities with advocates so that everyone is passionate about getting people into recovery. So hopefully, all of us listening to these stories have enough empathy that we can learn the same lessons that these ladies have learned and are telling us from their lived experience, so that we all don't have to go through the awful situation of losing a child to addiction before we step up and start doing something to help. So that's what your mindset should be when you're listening to these stories. And here we've got a crazy story from you guys, from Becky.
When I was being interrogated at the police station because I'd taken my son some books, Recovery Bible, NA book, a couple other things, and even some puzzle books for a little old man that was in jail. Mm-hmm. Unbeknownst to me, it had Suboxone strips in the spine of the book. So about 3 months later, grand jury indicted me, and I spent the night on the floor in the jail. Went in crying my eyes out, crying, you know. How can this be, you know? And then, of course, I'm beating myself up. I should have known. But actually, I did shake all the books before I took them, you know. Mm-hmm. Examined them and everything. Then all of a sudden, I just got a peace about it. And I thought, well, all my tears gone. And about 2 o'clock that morning, someone got put in my room and in the little shower room with me. She got a mat on the floor too, and she said, "You bring anything in here with you?" I'm like, "Oh my God!" Mm-hmm. I was able to start talking to her. She just had gotten out of prison. Mm-hmm. Able to talk to her about how she could turn her life around. The next morning, the person that came to bond her out was a preacher that he and his wife had started a house for people trying to get into recovery, make a change in their lives. But also I got another cellmate, and her son was an addict, and she was in there for some drug charges as well. And just to talk with them, to let them know that doesn't have to be what your life's like. You can change that, you know. And of course, you know, when she said, "What are you in here for?" and I said, "Well," I told her, she said, "Well, that's a this felony, this." I'm like, oh my gosh. Mm-hmm. You know, she's been on this road. I was like, you know, when they're telling me I can get 5 to 10 years in prison, and I'm like thinking, you know, we can get so burdened down because one of the officers said to me, "I would think that someone like you would know better." And I said, "You know what? You've not been someone like me for about 9 years now." Mm-hmm. My son went into that life. We didn't choose to go into that life. But when it comes to the point that that consumes every minute of your life and you're on guard, you're afraid someone's around you. And then after the jail incident, then I was afraid to go out because people would see me in a store and they'd walk away. What we had wasn't contagious. And I started telling people that. Or I got to where I'm going to go back out in that store. And I see that mom over there, and I went over there and said, "I just want to say I'm here for you if you need me." And she said, "Well, I'm glad you're talking about it. Can I talk to you about what we can do about my daughter? Mm-hmm. What's something I can do to help her?" Or she said, "You know, my daughter's out of the house now. What can I do for myself?" So sharing our stories, if we can save one life, and we already know that several of us have, we've saved moms and dads and sisters' lives just through Nar-Anon. Mm-hmm. Because sometimes it would just be easy for you not to be here anymore. You don't have to deal with it. But that's not the route we took. We decided that our life's worth living, and so is our child's. We want to offer every opportunity. She mentioned all the treatments her son had gone to. One weekend, for 2 days, we called trying to get my son into treatment, and his girlfriend as well. She was there at the house. To see the steps, things that have changed just because of mothers like you two that have gone to bat, gone to the police. You know, SPARK has gone to these other treatment centers and said, "Hey, when we need people in there, we need them in there now." Mm-hmm. You know, Marty going to get Casey's law for her son. She went in there. They didn't want to do it, so she took in the forms. Here's how you do it. You know, when she goes and tells the professionals, this is how you do it, mm-hmm. and goes through that, because it would be easier just to say, "No, I'm not going to do this." But no, it's like, we're not going to give up. We're going to keep on till we get more people in the community, more people in the legal system even. You know, we have lawyers that think it's wrong to do Casey's law on someone. You know? Mm-hmm. Well, then you look at them and say, what if that were your son? What if that was your wife? You know? So we're not just educating the people that live around us. It's mm-hmm. everyone.
Yeah. And it started back with this openness that you guys...
Yes, you have to do that, because forever we all just kept quiet. Well,
right. And you will find that every person who loves somebody who's suffering from substance use disorder feels like they have nobody. They don't want to talk about it to their friends. I'm not going to call the police because I don't want them to know my neighbors to know what's going on at my house. They know what's going on at your house. I mean, that's the bottom line. And so through doing even Casey's Law, you hear everybody's story. Everybody, they need to talk about it. They need to have an outlet to talk about their child or their wife or their husband or whatever. And so what you can do is refer them to, Nar-Anon, and there's also a SMART Friends and Family meeting that's available now. And Marty has set up a Nar-Anon Facebook page for Richmond. Always has readings on there. And I tell people, even if you don't come to the meetings, get on the Facebook page, because sometimes on your worst possible day, there'll be a reading that you really needed to see. So, it's about letting people know you're not alone as a parent or a loved one of somebody. And, we're always here for you. I don't know. I answer my phone all the time, probably too much.
She does. But here's the thing that we didn't have when we first started is you couldn't just get your loved one in a rehab that day.
No.
Mm-hmm.
Now we can.
Yeah.
If someone calls us and says, I want help, we can get them in a rehab today. There's free rehabs out there that we can help people get in. So we don't want money to keep somebody from getting, I don't have insurance or I don't have money. You don't have to. All you got to have is a willingness to get help.
And rehabs are taking people at all hours of the night. They didn't used to do that. It was 8 to 4.
Yeah.
Yeah, it's crazy.
That's the only time
and I always said, addiction is not a 9 to 5 Monday through Friday disease.
Mm-hmm.
It's not. It's a 24-hour, 7-day a week, 365 days a year, all the time. And I'm going to plug a wonderful resource here.
Please do.
It's called the Recovery Wagon. They're a wonderful group of people. They're peers. They're people in recovery. They're people from the treatment centers. And they're a blessing. And they will do whatever they have to do to try to get somebody. If it's 1 o'clock in the morning, you can get a hold of somebody to try to get somebody in treatment. They have a Facebook page, the Recovery Wagon, and the lady who does it, her name is Donna Martin, and it's 582 something.
I'll look it up and I'll put it in there later.
Yeah.
That phone number is 502-370-6884. Once again, that's 502-370-6884. And that is to reach Donna Martin from the Recovery Wagon. But that does bring us to the end of our interview today. Thank you guys for tuning in and for sticking out to the whole thing. And also a big thank you to our 3 guests for coming on. We wouldn't have a show if it weren't for people being willing to come on here, be vulnerable with us, and tell their stories. We really appreciate that. I think that we're all learning a lot from these stories. But it's important to remember that this podcast is only one part of a couple really big projects. The Powell County Cares Project from the Powell County Health Department and the Coach Project from Kentucky Rio. These 2 projects are really trying to instill some change in our community, in our area, and try to make things better. I'm thankful that we have the people involved here that we do, but we really have a long ways to go still. One last shout out to WSKV. Thank you guys for broadcasting our show for us. We really appreciate that. But that's all the time that we have today. Thank you guys for tuning in. You've been listening to The Local Lens from the Powell County Health Department in Kentucky Rio. I'm your host, Nate Brooks. Be sure to come back next week. These are our people, using our voices, telling our stories, because no one sees it like we do.